All right, what's going on, people? This is the Corner Store Podcast. My name is Rob on the mic. Follow us on YouTube, Stitcher, Spotify, Google Podcasts, and iTunes. Appreciate all y'all support. I got a special guest tonight. She is a licensed clinical social worker who provides a outpatient therapy related to mental health concerns, sexuality, and sexual function. She's an adjunct lecturer for graduate social work students, and she also holds a doctorate in human sexuality. Please welcome to the Corner Store Podcast, Dr. Natacha. Jacques, how you doing?
Hello, how are you?
Things are going well. Just trying to manage this pandemic, and just trying to keep sane because I got two little ones at home, and yeah, things are tough. So if they were a little older, the pandemic would have been like a lot easier. But since they're one, it's just a challenge every single day. So
if they can make their own food.
yes, yes. Like with the 1 year old, I got to feed her, I got to change her, I got to bathe her, everything I'm doing for her. So that's why it's more taxing. But anyway, as far as I'm gonna give like a brief background of how we got here, because like literally, this is like our second time talking in years.
Right? A decade, a solid decade.
And we had first met when I went to Hawaii for my 30th birthday, and we went to a luau. And after the ceremony, we ate together and we just chopped it up. We sat at the same table, and you was there with your mom. And I asked you, what was you doing? And you was like, well, I'm studying human sexuality. I was like, oh, okay. That kind of perked my ears. So, okay. That's interesting. That's interesting. And you said you was from Philadelphia, and we pretty much exchanged numbers. And after that, that was that. I believe I left the island maybe 2 days after that, because like the very next day we did the Pearl Harbor tour. Okay. And then the following day, we probably left and went back to the mainland. And fast forward to today, since I'm doing this podcast, I was looking up people I can interview that had interesting backgrounds. And I just happened to remember our conversation 10 years ago. So I went on Facebook to see if you were still there, and you didn't have the profile no more. So I went to the contacts. I was like, oh, I still have her number. So let me text her out the blue just to see if this is still her number. So
yes.
We text each other back and forth. I gave you my sales pitch about the show, and you was on board. So here we are. So thank you for coming to the show.
Thank you for the invite. Thank you for remembering me. Thank you for inviting me here.
Yeah, no problem. So like based on your background, I figured that you could be a content creator's wet dream. No
okay. Okay. Let's see. Maybe.
All right. So let's go with the first question. So now, like back in Hawaii, were you like an undergrad studying?
So a decade ago, no. So I graduated in 2007 from undergrad. Okay. And then from there, I did a graduate program, like it was like one added extra year. So like, why not? What's 1 year, especially when you're like 22 and don't even know what you want to do, next steps, like what's another year in school. So then I did that, and then I went into the workforce. And from there, you're very limited on what you can do with a bachelor's degree in psychology, right? Without a graduate degree, you're very kind of narrowed in, boxed in of what the opportunities are. And then, so from there, after I was working for about 2 or 3 years, and then started off with my graduate application process, which is a lot. It's really kind of pitching yourself to not just like institutions, like learning institutions, but individual researchers, right? Like you have to research somebody's area of expertise and reach out to them to see if they have or are taking students for the upcoming year. You have to make those connections first, and then like that going through the application process that way. And so during that entire process of looking for programs, I had always known that I wanted to focus on sexuality from like young. I honestly can't remember, when they asked, like when you're younger, like, what did you want to be when you grew up? I wanted to be Freud. Dr. Freud, Sigmund Freud, was the only person that I knew at that time that made a legitimate career in researching, in discussing, in educating about sexuality. And I was like, yes, that's the job, whatever that job is, I want to do that job, right? And so that's what got me into the path of psychology, because I thought that was the only way that I can get to that place. And then it was during my researching of graduate programs, finding one that fit my needs, I came across the program that I graduated from, which is Widener University in Chester, PA. And they are the, I think, one of two programs in this country that that allows students to earn a doctorate degree in human sexuality. And it's an accredited program, which is extremely important for any graduate program, is to have graduated from accredited programs. And when you apply for jobs, especially in like psychology or anything like that, they will ask if you graduated from an accredited program. So I found this program. It was quite serendipitous, like finding this program. And I was able to do another dual programs, a dual focus. So human sexuality is one degree, and social work is the other degree. So the combination of those is what allows me to call myself a sex therapist, if you will.
How many Black women do you think holds a doctorate in sexuality?
So that's a fantastic question. Because we know like Black women tend to be the most educated in terms of like tiers in graduate programs, right? In my program, I will say there is a more than you would think. More than you would think. I can spout off right now about 10 women who graduated. Now, that's not to say that's an exorbitant amount, right? But I think that when we think about graduate degrees, and when we think about like healthcare focused graduate degrees, we tend to see them as white European women. Right. There was a level of comfort and familiarity being able to be in a program where there were women that looked just like me and women who had similar backgrounds. And being able to connect that way, because graduate experiences can be extremely lonely, especially when you get to the dissertation phase, because you're no longer in a school or a classroom at that dissertation phase. You are solo researcher. You are at your own desk. You are researching day and night, writing day and night, which is very, very, like I said, it's a very like isolating experience. So having made those connections during the class process was like really important.
How long was that process for you to write your dissertation?
So long, too long. In my opinion, it took me 5 years.
Oh, wow. Okay.
And that was just the dissertation process. That's not like being in a classroom. That's not that our part of education. It is literally the research. So what happens, at least graduate programs can do it differently. There are some graduate programs that to earn your doctorate degree, you just simply need to publish, i.e. you need to put your research out there in the world. Other graduate programs like mine required a dissertation, which is a lengthy document. It's extensive. It comes with a literature review. It goes through a committee. Multiple iterations will go through a committee that have a say, right, in your research with the intention of improving it. Because these are kind of your, not to say, sorry, Philadelphia is super loud, not to say your elders, but the folks in the program, the administration of the program. My committee included 3 people, and they all are coming from different spaces, right? They all bring a different level of research, a different expertise to it. So it really felt at certain points that I was trying to make 3 different minds happy, right? And like, how do I make you happy? But that person over there didn't really like that idea. So I've got to try to like make it so that everybody's feeling good about what I'm producing. So that process actually took like 4 to 5 years to do.
Now, in that 5-year period, like, did it literally consume your whole life? Like, were you working full time at like doing that stretch as well?
Yeah, I was working full time. My weekends were dedicated to this part of my life. I would allow myself 1 weekend a month to like truly, interact with my loved ones or family or friends or whatever. But most of the time was dedicated to writing. I actually had to change my work schedule so that I can accommodate this, right? Because when I was working 5 days a week, that allowed me a few hours in the evening and then 2 days on the weekend, which you have kids, like there's just, the weekends are not sufficient for anything. Like you really truly can't get anything done on the weekends, right? And that's this magnitude. So I approached my bosses at my day job and I was just like, look, I what I'm realizing is that I need time specifically dedicated to this. And so I proposed 10-hour days. And thankfully, my bosses are really accommodating. They're just, the kind of people that are like worry about the work getting done, don't really care about like where you put it. They just want the work to get done, right?
Oh, that's cool.
So yeah. I mean, and that was like the first 2 years of the process that I was realizing like why this was going so slow. It's because I didn't have that dedicated time.
Okay.
And so once I got that dedicated time, things got to speed up. But it really is like a hurry up and wait process. So I would finish, a few pages, I would finish a section, I would finish a chapter. Now I got to wait for my committee members to give me feedback, right? And they are full-time researchers or full-time clinicians, therapists, or full-time educators. So I'm not their only priority. So they have classes to take care of, and students to take care of, and other dissertating students to take care of. So it was very much a hurry up and wait process of like, finally I got it to you, but it could be like 3 or so weeks before I heard anything back.
Oh, that's cool. Wow. I mean, you can reflect back on that whole experience and you completed it. And now you're up to this point.
Yes.
You are officially a doctor. So yeah, kudos to you. I really
Thank you.
proud of you. So
Thank you.
now let's get to the fun stuff.
Okay. Okay.
Now,
All
remember
right.
the question I had asked you, because you was wondering like what type of question I was going to ask you. So like, do you remember what I asked you via text?
I do. And I actually wanted to start with one of the other questions were misconceptions. You would ask about misconceptions that people have related to sex or sexuality,
Yes.
right?
Yeah. Okay. Yeah.
I figured that would be like a nice kind of seam way into the question that you asked,
Okay.
because I find that to be a misconception that people have.
Okay.
So given that, and I did write a few, but given that the question that you asked was specific to the female orgasm,
Yes,
which tend to be this elusive, mythical unicorn for a lot of reasons.
Okay.
But the specific question I was, and definitely correct me if I got it wrong, but it was basically the difference between like a vaginal orgasm and a clitoral orgasm, or why is it that some women can have one and not the other, right?
It was something like maybe 90% of women like don't have a consistent orgasm versus like 10% they have them all the time. So I was wondering, is that the man not putting in work, or is that nature?
So that's where some of those misconceptions come in, right? That's definitely some of those misconceptions. So the first thing, and I remember texting back, is like, so there's like a few things I want to say about the way you phrase that question. But the first thing is the assumption that people give orgasms, right? That I bestow a gift of orgasm onto you, and that's how that is occurring. And that's not the case, right? Orgasming
so has nothing to do with the man at all.
No. My pushback was on the statement, is it something the man did wrong, or can a man not give a woman orgasm? And so I'm going to reframe that, because I think that this is culturally why female orgasms tend to be this elusive kind of unicorn, even for women, right? Is this idea that somebody is bestowing this onto you, that somebody is giving this to you, i.e. that you have no agency, or you have no power really in orgasming, and that your body has the ability to do this.
Okay.
And that is very much a byproduct of our culture. Consider even your experiences with sex ed, if you even have sex ed, right? Because we know like throughout the country, not everybody gets sex ed, and not everybody gets
public school. It was very, I don't know, elementary, I guess.
And probably more of like how to make a baby and how to not get STIs, right?
I have a funny story about as far as the whole making a baby process, but yeah, go ahead.
but that tends to be sex ed, is like going through puberty, right? What happens when males go through puberty, what happens when women go through puberty with menstrual cycles and all. Babies, like making a baby, and do not get AIDS. Don't do it. Don't do anything, because you're going to get something and you're going to die, right? Like that is the crux really of the sex ed that we get. And so even when I'm bringing this up with the students that I teach, or even in some therapeutic spaces, I'll ask the question of like, what do you think your relationship with sexuality would be like if there was a conversation of pleasure and desire in your sex ed?
Well, maybe the schools may see that as taboo to
Why do
like
you think
talk
that?
about the pleasure of it.
Why do you think that?
Uh, I mean, we're talking 20 years ago, so maybe they wasn't progressive in that way back then.
Hmm.
I'm not sure how it
Hmm.
is now. I mean, imagine, I mean, my kids are very young, so I'm not sure how it's gonna be whenever they get to that age.
Yeah.
But like back then, I don't think they were that progressive in order to do that. So
No, for sure. And I mean, even my experience as well, which I'm sad to say is probably just as long as yours, but yeah, there is no conversation of pleasure or desire. And even the word pleasure has this connotation of like sexy taboo, right?
yeah,
When in and of itself, we want everybody to have pleasurable experiences. If you take somebody on a date, you hope that's a pleasurable experience. If you do things with your kids, you hope they like get some pleasure out of going to the park with you, right? It
right.
doesn't necessarily have to be this erotic pleasure. But
Hmm.
like, what would it look like if the conversation also included pleasure and self-pleasure, right? As opposed to just like masturbation is a thing that you can engage in. But what does pleasurable sexual experiences look like for people? um I think that is like one layer of how we get to be, teen adults, as I call them, like folks in college age. You still got that teen brain, but you're still legally allowed to do things a lot by yourself.
Right.
But you still, that's how you get those teen adults that kind of go into these experiences of casual sexual behaviors, right? And this assumption that men are definitely supposed to get off or orgasm or come, right? That's a given. Men should definitely come from a sexual experience. And if they don't, it's a failed experience in some way, shape, or form.
And
But
and,
there's
and, and
never,
men actually pressured, at least for the first sexual experience, like we are expected to like hit it out of the park.
yes,
Because for that sexual experience for the first time, then if you come early, then that's like a huge bruise to your ego.
right,
So we always
right.
expected to perform at least like the first encounter. So yeah, go ahead.
Sure. But that's a valid point, right? Like, and so here's the image of, or here's the setting up the stage, right? You come from kids learning about sex in their school, and getting those very basics about sex, right? Like puberty, menstrual, pregnancies, and sexually transmitted infections or illnesses, right? And that's it. And then you fast forward to what happens in the teen years where folks get a little bit more exploratory. Now we live in a world of everything is accessible through a Google search.com, right? And
We live in a
so,
world of hot girl summer and WAP right now.
well, we live in a world of hot girl summer and WAP, but we also live in a world where you can easily type in to Google like sex or penis or dick or tits or
Oh yeah.
something, and porn will come up.
Oh yes.
Porn
Yeah.
will easily come up, and kids can access that, right? So now that is their education, right? If their parents didn't feel like comfortable enough to have those discussion of like pleasure or consent or whatever that may be, now they're using porn as their educators, right? Or even just like casual movies where I was recalling, and this was triggered when you had said like if you come too quickly, it's a failed experiences. But like all of those like teeny bopper movies of like a girl hugging a guy and he comes and has an orgasms and it's
Oh yeah.
weird for everybody,
Yeah.
right?
That actually that's what made like American Pie like so
Yes,
hilarious at the time. So
yes. And we mock those people, we mock those
yeah.
experiences, right? And again, none of that is even explaining or introducing female pleasure in any way. And
Right.
so guys, don't come too quick because it's going to ruin the experience, whatever that may be. Also, you should last longer because maybe somehow that's going to make a woman feel like pleasure in the experience, but nobody's talking about like how that happens,
Wow.
right?
Yeah.
And then we pair that with women not even being taught that, right? Women not even feeling a sense of agency to explore that for themselves. We're still coming off of um, inundated with these messages that women should be virginal, right? Women should be the gatekeepers of men's sexuality. So men are really the sexual aggressors, and women are here just to tame them. And that's our purpose. Like we should just we have to care for them because without us, they'll just go ravage the world in a sexual spree, right? We have to tame men's sexual functioning. And again, in that conversation, there's nothing there that we're talking about female pleasure, nothing at all. So when you asked about the difference between clitoral and vaginal orgasm and the percentage, and had made that comment about men, I'm like, that's one of the misconceptions. That's like that's a big one of where we as a culture get it wrong, right? If we are interested in women's orgasms, one, we should ask women, how are they doing it on their own, right? So we ourselves are our best teachers. How can I show my partner, or any woman, right, explain to their partner what feels good for them, what is pleasurable for them, what results in an orgasm, if I don't even know what that looks like for myself, right?
So you're saying that women should often masturbate?
Yes, it's your own body. Everybody should explore their own body, just the way that we have normalized boys exploring their own bodies, right? There's so many out there, so many messages out there of boys using socks for assistance in masturbation where they're teenagers, or, you know, having a bottle of lotion, or quickly covering themselves if a parent walks into the room. But we do not see those same messages about girls. We do not see those same messages about girls at all. And so now we get into this adulthood of even women are given this message that a good sexual experience is if your male partner is able to bring you to orgasm, when that female might not even know how to do that on her own. So now I'm waiting for somebody else to make me happy, right? Oh, yeah. And we're going to equate orgasm with happiness. And now I'm waiting for somebody else to make me happy. And we know in any relationship, whether that be romantic or platonic, that we are in control of our own happiness. Granted, other people can be along for the ride, but like, this is on me to be able to indicate what can make me happy, and how my partner is able to work with me to support me on that, if you will.
Awesome. Okay, cool. All right. Let me see. Okay, so you're done with that part, right?
Well, the other thing I wanted to say about the female, or I could go for days on female orgasm, but the other thing I wanted to say about female orgasm is the other misconception that these things are different. That a vaginal orgasm is a completely different experience than a clitoral orgasm, when that's not the same. That's not the case at all. The clit is a bigger structure than most people realize, because unfortunately, the entire structure of the clitoris wasn't actually discovered until the late 90s. So we have, yeah, I know, it's a shame. It's a shame. So we have this idea that, like, now I'm looking around the room for like things, whatever, but like we'll have this idea of the external female genitalia that kind of looks like, you know, like this. Okay. And then the clit will be this little kind of dot like right here, right? And then we're thinking that's it. No, the clitoris looks more like a wishbone. In fact, we're just seeing literally the tip of the iceberg. So what's actually happening is that if we have and I have nothing around me, but a vaginal canal, if you're just thinking about like some sort of holes, right? A canal, like a circular object, the entire structure of the clitoris will like cup it this way, if you will. Okay. And then this is a terrible, terrible diagram, but this is externally. You know it just fine. This is externally what we see, but really the legs of the clitoris are cupping the vaginal canal. So when people are describing kind of this deep penetrative orgasm that they're having from like penetrative sex, something going into their vagina, it's simply because it's hitting the clitoris in a different place.
Oh, okay. Wow. Learn something every day, I swear.
These misconceptions, right?
Now, you had mentioned something about like a prostate orgasm. Now,
yes,
because I never really heard that before.
Yes. So men, this I actually do have a little structure here, so don't mind all the notes, but I will show you like the true educator that I am. So this is a structure of the male genitalia, right? So this little kind of acorn looking thing is the prostate. And so you'll notice that these two structures, of course, are the testes. The tubes come from the testes, the epididymis, travel up it, travels through different structures. Along the way, along that travel, so if you're thinking about ejaculation, along that travel, the sperm is leaving the testes, leaving the epididymis, traveling up those tubes on both sides, and going through like 3 different structures to pick up material that makes semen. So another misconception is that people think semen is predominantly sperm, which is not the case. In semen, there's about 5% of it is actual sperm. The rest of it is these other materials that's picked up from these other structures. One of those structures being the prostate. The prostate provides, I think, like a quarter or so of the material in semen. And it's just kind of like this, it's this gland that produces like exocrine material, so that it can save the sperm when it goes into the vagina, because it's acidic and it's not, it's not meant to live in that environment. Okay. But where the prostate is, it is easily accessible from the anus. And so anybody who has a prostate can experience a subjective and a physiological release from manual stimulation of their prostate.
Oh, okay. All right. Well, I was just wondering because you mentioned it during the text, so.
Yes, okay. Yes,
okay.
absolutely. Okay. There's also that, like, I forgot when this was, but I think it was like a few years ago. There was this like a news article. I think it was like a person in Florida who like shot their doctor because during a prostate exam that man had orgasmed or ejaculated, and like shot his doctor as a result of that. Oh, right. Wow. And so talk about education, talk about how much education is necessary. So you have this potential man who's thinking that, some negative experience happened, that he was violated in some way because he ejaculated, when really how much of education could have been helpful if he knew that was going to happen, right? Again, if we teach our children about their bodies and what could happen in terms of sexual pleasure, they just have more agency over their own. They have just more autonomy, right? They have more control. They have more ownership of their pleasure. And there's less of the stigma of like, oh gosh, if somebody stimulates my prostate, that means that, that questions my orientation. No, this is just like your body reacting to a pleasurable experience. Okay. And like, why not keep these good times rolling? If something feels good, like why exactly does it have anything to do with questioning your orientation?
Now, following the incident, did they change procedures as far as like at least let a man know, like, hey, if this happens,
I don't know. I mean, I think that the doctor should have, if they hadn't already, right? Because I was just reading a news article, but if they hadn't already, they should have gone into detail of like the possibilities of what could happen, right? With any sort of procedure, when we go to the doctor, we tend to get this list of things that could happen as a result of this procedure, right? Mm-hmm. So I'd like to believe that the doctor prepared them, but it could have been that patient was not aware that reaction could happen and had a very violent reaction as a result.
And what's the recommended age to get a prostate exam? Because I hear it's 40, I hear it's 50. I really don't know. Like, what's the recommendation?
What I've heard from medicine is that there's also a layer of risk, right? If you are from a family that there is a higher risk of prostate concerns, then the earlier the better. Okay. If that's not, a family history that you have, then maybe it could be 50. But I do think that I do think that medicine is leaning towards like younger because of the preventative nature of it, right? Like we obviously can do stuff if we can start assessing or testing for things as early as possible.
Okay. All right, cool. All right.
Yeah.
Next question. I consume like a lot of Black YouTube rabbit holes.
Okay.
So I hear conversations all the time. I'm like a final wall, and I hear things like yeah, if a woman was to sleep around and she won't have the ability to pair bond. I mean, is there any validity to that? Like,
yeah,
if she has like a lot of bodies,
So why do we think that's different for anybody? Why are we just concerned about women's ability to bond because of their body count? Would be my follow. I know that this isn't your question, but would be my follow-up question to the conversation of like, do we not care about men's ability to pair with their partners?
I mean, people may say that, well, because of nature, I mean, men are kind of meant to have multiple partners while women supposed to be like, I don't know, barefoot and pregnant all the time. As far as the whole human history of the way men and women operated. So that's just my educated guess about it.
Yeah, for sure I would challenge that, because thankfully we're not in some sort of cave requiring fire, right? Like we are very much living in the future of evolution, and people are capable of doing a lot of things regardless of their sex or gender.
Uh-huh.
But there's nothing that I've read that has indicated in the research, like, and this is like empirical, like peer-reviewed research to indicate that the amount of sexual partners has a negative impact on a person's ability to connect with a future partner.
Mhm.
Now, what does impact a person's ability to connect with a future partner is the surrounding factors of why that previous relationship ended, right? And we see this even in like research projects that are other types of mammals, like field mice and stuff like that. We see this there too. So basically, in like everyday term, it's like your baggage, like literally it's the baggage that impacts your ability to connect with another person, right? Or limits that, or has some sort of barrier to that. So how long was that relationship? What were the surroundings about why it ended? Were you widowed? Were you dumped? Was it cheating? Was it mutual? You know what I mean? Like there's those factors play more of a role in people's abilities to connect with future partners than just simply who you've had sex with.
And what's the scientific like chemical reaction as far as what makes a woman kind of like latch on to like her mate? Like what's the actual term for that?
Oxytocin, I think, is maybe what you're looking for. So that's like a brain chemical.
Yeah.
It plays a role in a number of things. It plays a role in a woman giving birth. Actually, it plays a role in orgasming. It plays a role in breastfeeding. Really, it's kind of like one of those like feel good hormones that they'll always tell you to like search after, right? Like dopamine's another one of those feel good hormones. So you should go outside and you should run because those increases your levels of like X, Y, and Z.
Hmm.
But in terms of like the brain, that's kind of what's being released at that point. And there's a lot of research to indicate like, drops in oxytocin, like depending on the length of a relationship or like where spikes occur and stuff like that, right? What we know about medicine is that we don't know as much. There's just a lot of like hypotheses and theorizing, and studies can be quite inconclusive from like one batch to another, right? Depending on like what kind of women that they surveyed in terms of the relationship. But oxytocin is one of those brain chemicals that you'll hear a lot of when we're talking about female sexuality and female sexual functioning.
Okay. All right, cool. All right. Now, as far as Western culture, is sex taboo or is it lax? The reason why I ask this because just for example, we have celebrities like Steven Spielberg, where he has an adopted daughter.
Mm.
Well, have you heard about that story?
It wasn't Steven Spielberg that I was thinking about. It was another director. Was I thinking about Woody Allen? Maybe is that the director that I'm thinking about, who has a daughter adopted from um, a different, like an Asian country. I think it's Woody Allen that I was thinking about. But continue
Okay,
about
well,
Steven Spielberg.
like Steven Spielberg, he's worth probably $2 billion, and he has his adopted daughter, in which she chose to go into sex work.
Okay.
And then you hear a story like Lawrence Fishburne's daughter when she ended up
Hmm.
going into the porn industry. So me, I have a like an old school mindset. Like if I was their father, I would be heartbroken. And my daughters was to get into sex work after I raised them to like be like a certain individual that can contribute more things better than like a sex worker per se. But my thing is, I mean, is Western culture too lax, or is it or just still taboo as far as the way that we kind of view sex? Like, should we view it as a big deal about them going into the sex industry?
And this is my personal opinion, right? I think that we very much have we still continue to have a traditional view of sex and sexuality. We still view it as something that is supposed to be exclusively done between two people in a committed relationship, right? And those two people, because we live in a heteronormative society, those two people should be male and female. They should be a man and woman. That's what we see it. We also see it in the confounds of marriage. That's where really sex should be taking place in a private bedroom, and you don't talk about it and it works out fine, and men orgasm and women don't, and that's also super fine, right? I think that's very much still a traditional view of us as sexual beings. Because another misconception is that we become sexual beings like when puberty hits, which is not true at all. Like, we are sexual beings from day one until day zero. There are evidence of like sonograms in where you know, fetuses or you know, babies in the womb who have penises are touching themselves, right? People who have male children or people who have penis bearing children will often say that like their kid can't keep their hands out of their pants, and it's not that they are touching themselves for erotic purposes, right? But it is a reactionary self-exploratory behavior, and also feels nice and feels good and it's pleasurable. We don't talk about that. We don't see that. And then as a result of that, we tend to have a very negative view when we are presented with children who touch themselves. We assume that they are engaging in adult play, and that's truly not the case. For some children, it could very much be an indication of sexual assault, right? It can be very much a mimicking of something that had happened to them or something that they're seeing. But that's where the intention comes in. For a lot of children, it's simply self-exploratory. And then they then learn shame related to this because of their parents' reactions to it, right? Their parents tend to like, you know, reprimand them or you know, yell at them in surprise, and not to say scream at them, but like just simply shocked that their kid is doing this, and they're like, oh my gosh, please stop doing that, right? And children internalize that, and our children are very much reward based. So when a negative experience happens or negative consequences happen, they remember that, are like, okay, the last time that happened, I don't want to do that again, right?
Right.
So we have that knowledge of that sex is really only for certain small groups of people, and that tends to be people who can reproduce, or people who have childbearing age. And again, adding that into the layers that I said. So yes, I do think that our culture is very that we are still very, very traditional of how we view sexual behaviors and sexual activity and sexuality as a whole. I do think that we are met with, or we are shown a lot of sexual images because we live in a capitalistic society, and things that are secretive and things that are taboo and things that you shouldn't talk about are definitely the things that people want to see and want to do and want to talk about, right? So there's a lot of money to be made when the topic of conversation is sexuality, whether that be the topic of the podcast, whether that be the topic of movies, whether that be the topic of music, right? Sex sells, and sex continues to sell, right? And it's a very easy way to shock and awe people, kind of sensationalize it for the purpose of money.
Now, would you be for or against the legalization of prostitution?
I would be for the legalization. I am for the legalization of prostitutions. I mean, Vegas, prostitution is legal in Vegas, right? And then with legalization, we're able to put protective laws around it, right? There's a lot of things that we can do to keep people safe. We could keep sex workers safe, as well as people who are the consumers of sex work. There's a lot of things that we can do to keep it safe, to regulate it, right? And this is kind of a similar conversation. In my head, it's a similar conversation of when we're talking about legalizing marijuana, right? There's a lot of things, once we legalize it, then we can put a little bit more control on like what's in the substance, right? And that's the same with sex work. We could put these kind of boundaries of what can make a safe experience for everybody.
Now, in an indirect way, the whole marriage institution to me is prostitution, but that's just my
Why tell me more about that.
I mean, it's just a tongue-in-cheek type of comment. I mean, like, if I can't be a provider monetarily, then obviously that won't be enticing for a woman to marry me, right?
What if the woman was the breadwinner?
If the woman's the breadwinner, like, I have this running joke. I hate to even say
I'm nervous. I'm nervous.
If the woman is the breadwinner, then like eventually a pussy will be as dry as the Mojave Desert eventually towards that man.
Oh, okay. Why is that? I mean, you're not. Okay, I'm gonna let you finish, but yeah, tell me more. Why is that?
I'm done. I'm done.
Oh, you're like, that's it.
Yeah, that's it.
No, I was gonna say, there is, are you familiar with, it was like a Showtime show, I think it was called Masters of Sex. This was like a bit ago. It was not a new show. It's like I think it's already over.
I may have saw a title once or twice, but no, not really.
So it was a kind of dramatization of sex researchers. Masters and Johnson were the researchers, and they are credited with, they are one of the people that are credited with help revolutionizing our understanding of the sexual response. And for them, the sexual response was very much a bell curve, right? Like you have desire, and then something happens to allow arousal to happen, then climax, and then you go to sleep, or there's a refractory period.
Right.
And for so long, that was the standard of like how sexual responses occur in the human person. And then later on, female researchers like what is her Rosemary Basson, like female researchers like Rosemary Basson came in and expanded on the sexual response to specifically for women, to indicate that it's not the spontaneous desire thing, right, that now gets me horny, that there's a lot of things that go into women's interest or women's want to engage in sexual activity. And so even though you joke around about like the Sahara Desert,
Mojave Desert.
Sorry, the Mojave Desert, but that there is, that is one of the things that can contribute to women's interest in sexual activity, is a sense of security, whether that be financial stability, or whether that be, I am safe with this person. I know that this person won't hurt me emotionally and won't hurt me mentally or physically, right?
Right.
And that is not just a spontaneous, like, all of a sudden I'm horny. It's like, no, I'm feeling safe and comfortable in this dynamic, in this situation. And as a result of that, that is contributing to my interest or my want in sexual activity.
Okay, cool. Now, you work with female veterans before, right?
Yes, my research is in female veterans. I mostly work with male veterans because, as you know, there's just like a lot more men veterans than there are women veterans. Although the numbers are changing, of course, as the times go. So my research is with female veterans. My day-to-day practice oftentimes tends to be with male veterans, but still surrounding like sexual functioning and sexuality.
Now, in regards to like certain MOSs, do you think that like in previous research, there's certain like stress, physical jobs kind of like cause certain sexual functions to like not work properly, or I'm not sure if I accent it right, but
Not that I've come across in my research either. What the research tends to be unanimous on is that female veterans as a whole tend to experience a number of illnesses or functioning concerns at higher rates than their female counterparts that are not in the service, as well as their male counterparts that are in the service. We'll see higher rates of depression. We'll see higher rates of trauma-based PTSD. We'll see higher rates of sexual functioning concerns for them. And there's a number of reasons why that may be. Two, like physical injury, right? Because we know that veterans have higher rates of like chronic pain due to the stress that was put on veterans' physical bodies. Veterans also placed in situations, or active duty members, especially if they've been deployed to war zones, are at risk of developing PTSD, post-traumatic stress disorder, which we know in the research also has a negative impact on people's sexual functioning, regardless of their sex, right? That men will have harder times maintaining erections, that women will have harder times, feeling aroused or getting lubricated, as a kind of side effect or as a byproduct of these other illnesses that they're dealing with. So I haven't read anything that was exclusive about, women who had this particular job or women who were in this particular branch of the service experienced stuff more or less. But that just in general, veterans tend to have a higher rate of these concerns than civilian population.
Okay. Have you ever seen the show Homeland?
No.
Well,
Mm-mm.
that was a scene in which like this veteran, well, actually he was still active duty, but he was like a POW for like maybe 5 or 6 years or whatever. But he found out, well, they found out that he was alive, and then eventually he got sent home.
Mm-hmm.
And on the first night he got home, his wife tried to be intimate with him. He couldn't get intimate. He had to kind of like masturbate in order to
Mm-hmm.
get off, but he couldn't, be intimate with her at least for like the first maybe few nights or whatever. But I thought it was kind of
Absolutely.
interesting. So
Absolutely. And like that is, and when the veterans that I work with, when they are presenting that concern, like my first thing to do is like normalize that experience, because that is a normal reaction, right? That we're seeing a lot more of this in somebody who has no impact to their sexual functioning. Not to say that having a diagnosis of PTSD immediately equates, ED or erectile dysfunction, right? We're not saying like the one is going to result in the other, but we're just seeing a correlation. We're just seeing higher relationship between these two. And that has a lot to do with how our body processes fear, right? Our stress response. So if you're familiar with the fight or flight response in our body, right? So that when you're in the presence of danger, just from an evolutionary standpoint, that there are our central nervous system will go into action to be like, we're either going to fight to keep us alive, or I'm going to run away to keep us alive, right? All with the same goal of making sure that we stay alive. And so for people who go into war situations or are in or exposed to these kind of high stress situations, that fight or flight response is like easily triggered and sometimes consistently on, right? That they're always on guard, that they are always kind of hyper vigilant, that they are always kind of like hair triggered, right? They're just like a little bit more irritable because they're on edge, right? Because they're again just activated. They're just consistently on. And so I'll tell my veterans that, it's a very much a misconception that when you come back to the States, that this turns off, that you are now safe, your body knows that you are now safe, and that this is no longer an issue that you're going to be working with, which isn't true. Because when folks go to war, they've actually trained their body to do this, right? So that they can stay alive and that they can keep them other members of their unit alive. It's way better for you to be on guard than you to be like sleepy Winnie the Pooh when danger happens, because
right.
you might not walk out of the situation.
Okay.
So to think that when you come back to the States, just because you're home, that this alarm system that you've trained to be a little bit consistently on is just going to turn off is not the case. Now, as it relates to sexual functioning, and this makes sense from an evolutionary standpoint, right? So the same system, that fight or flight system, is counter to the system that allows arousal to happen, that allows erections to happen. Because think about it, when you are in danger, if there is a lion in front of you, the last thing that you need is to be sexually aroused and get an erection. Your body does not need that. You don't need that. The body needs blood to go to other areas of your body to keep you safe, like your heart, like your brain. It does not need blood to go to the penis at all. And so that system turns off completely that arousal system, which is controlled by the rest and relaxation system in our body.
Oh.
So because you come home, the system of your body is already like triggered and already on, right? And then you're attempting to engage in any sort of like sexual acts or intimate acts, your body's like, oh no, the last time that my heart was racing, the last time that I was this sweaty, the last time that I was hyperventilating, I was in danger. I know this means I'm in danger. No, there's no erections that can happen. That's not what we need right now. We need to keep ourselves safe. So we need to run. So it becomes like this kind of consciousness of like, no, I'm safe. I want this to happen. And your body being like, well, the last time this happened, last time that, our body had these kind of same reactions, we were in danger. So we're in danger. We got to go. We can't just be here.
Oh, awesome. Awesome. Yeah, that's good
Yeah.
information. Okay.
So it's a lot of work to like kind of train our body. And that's where mindfulness activities come in, mindfulness exercises come in. So we can kind of tap into that rest and relaxation system in the body, turn that back on. and a lot of cognitive work for folks. Sometimes folks have flashbacks, which can impact sexual functioning, right? Sometimes folks have these intrusive nightmares that impact their sleep. And if you don't get enough sleep, you're physically tired and your body's also not getting enough oxygen that it needs and stuff. So, or not just oxygen, it's not producing the things that it needs to do to allow sexual functioning to happen.
Okay. Now, next question. When the DSM was first published, certain sexual preferences was labeled disorders, and then later they kind of took them off the disorder list. So, do you think when they first published it, did they have it wrong, and then they did a self-correction, or vice versa?
They had it wrong. So the DSM removed homosexuality as a mental dysfunction or mental disorder around DSM-3, which I think specifically the year was like the early 70s, like 1973. And so it removed it as a pathology. And we also have this history of medicine being like one of the major oppressors, not even just simply for women's sexual functioning or members of the LGBTQIA queer folks sexual functioning, but even for various races, right? Like we know that pretty much if you were othered, you were easy, kind of like, not to say target, but you were easy research material, right? We know this from Tuskegee. We even have, I was looking at this recently, there was a researcher from University of Penn, I think in the 70s or 80s, that had done research with inmates that tended to be more Black or brown on, like, I think it was like headache research, but had done this without going through the proper channels. And so medicine does have this history of oppressing people and pathologizing people. So I think this was very much a corrective action in the 70s. And that also had a lot to do with what was going on in the zeitgeist of the world with the LGBTQ movement, right? Because we also at that time we're having like Stonewall. We were having the Stolen Riots, I should say, in New York City. We were having marches and things like that. More acknowledgement and more normalizing of this orientation as an orientation, and it's an identity. It's not something that is a sickness, or that's something that needs to be corrected.
Okay, cool. Now, I actually about the term super straight. I just learned about this term recently.
Me too. I mean, I heard it from you first. I had to like go
Yeah.
Google it. Yeah, I
Okay.
was like, what does that mean?
It just seemed like the goalpost is constantly being moved. So like yesterday, prior to learning super straight, I'm a straight man.
Okay.
But I can no longer say that because it's assumed that I would be attracted to a trans woman.
Okay.
Now, in order for that confusion not to even be present, I have to say I'm super straight, which means as a cisgender man, I plan on not having a sex change or being attracted to any man. I have to also be attracted to cisgendered women who has no desire to be men, right? So I just think that like every few years, new language is being developed and it's constantly confusing people. So, but I just wanted to get your take on it.
Yeah. So, like I said, you were the first person I've heard use the term super straight. So I too had to go on a Google experience. I was just like, what does this even mean? Like, what is happening? And so from my reading, and you probably went down the same rabbit hole that I did, is that this was something that like really recently came into the lexicon, right?
It was a TikTok video that
Yeah.
I think it was like a teenager that like said it and it just went viral. So
Yes.
yeah.
But I also learned that that video has been taken down from the original poster, right? And that has been like reposted.
Okay.
And so the idea was, I think, kind of along the lines of what you said, that we're feeling like that language is consistently changing, and maybe identifying in certain ways can, accuse somebody of being like misogynistic or transphobic. And from what I've read, that the term, as a result of that, has a level of transphobia involved. And to say that I now need something specifically and exclusively to
Yeah, but
specifically and exclusively.
it's a preference. To me, it's not a phobia. It's just a preference.
So So is the preference, and not, not asking you, but in general, so the question that I would ask people is that, is the preference or is the concern about genitals? Like, is this an idea of like, I only want to sleep with bodies that have uterus, ovaries, and vagina?
To me, to me, like, you know what? I am so happy that I'm not in this dating market. I've been with my wife for over 10 years, but it is so savage right now. But the bar has gotten so low. I have to ask, well, I would ask women, are you an X or a Y chromosome?
Okay.
So that's it. So I will have to ask that. So if you are a X chromosome, then yes, you have a uterus, you have ovaries, you have a vagina. That's what I'm attracted to.
So if we're using just chromosomes and if we're using genitals, so the challenge that I would have for somebody, I understand that you're playing devil's advocate, but the challenge that I would have for somebody is that, fantastic, would you now date a trans man?
No.
Would you date a gay man who is also cisgender?
No.
So then it doesn't have anything to do with the genitals, right? It has nothing to do with chromosomes.
Total package, femininity, you have to look good. You have to have a vagina, breasts, butt. I mean, it's just a total package. I mean, to me, it's not really hard, but it just, to me, I just think that they're just muddying up the waters to like make everything so confusing. So,
What's the challenge I would have is, what exactly is confusing?
because like, I was listening to like a Breakfast Club interview with they was interviewing Angela Stan King,
Mm-hmm.
and she was like against the whole like if a trans woman was to like date a man and not reveal their change, and then what if they was to like want to have kids and that man doesn't know that this is a trans woman,
Mm-hmm.
something like that. And then Charlamagne says something like, well, maybe after a certain amount of time, they may fall in love and that won't matter anyway. I'm like, really? Are you serious?
Mm-hmm.
That's that's not the point.
Why?
Why? What?
Why is it not the point? I mean, how, I understand that you've been out of the dating market for
Yeah.
some time, but like, recall when you were dating,
Uh-huh.
was questions of kids the first thing that you asked on date one?
Um, when I was in the pursuit of like trying to find a wife and so I can have kids, yes, like eventually, like early in the stages, yes, that was talked about.
Early in the dating, right? And
Yes.
so, like, on also additionally, and this is a conversation of like basically revealing, when in the relationship dynamic do you reveal aspects of yourself that you might not be comfortable to reveal, right? So I would also ask a question of like, if I was a victim of sexual assault and I'm, still dealing with that, is that something that I disclose on the first date? I don't know this person. I don't know how safe this person is. I'm still trying to vet this person on safety, right?
I
So
I,
I
I
bring that up
totally
to
get it.
say that there's things that I, regardless of anything, don't feel is owed to the person on the first date. The first date, I'm just trying to see if
Okay,
we can
let's
even
let's keep
jive.
it let's keep it in the context of like sexual activity. So like if a man was to take his condom off and the woman, for all she knows that he has a condom on, that's called stealthing, right?
Yes, rape,
Right? Right.
rape.
Okay, exactly.
Mm-hmm.
So if a man, a straight man was to sleep with a trans woman and he not
Mm-hmm.
know that that's a trans woman, he did not give consent to that, correct?
Did he give consent to the sexual activity?
Now, I mean, if a man is straight, he is obviously consented to the fact that yes, he's assuming that he's sleeping with a cisgender woman, right?
Why is he making that assumption?
Because you come into his psyche as a woman, right?
There you
Should you,
go. I'm a woman. I don't I It's a conversation that a person gets to decide if they want to or not have, right? And so
right?
there's a lot of folks in the trans community that just don't feel safe revealing these things, right? Because we know that there are higher rates of physical assault, sexual assaults for members of the trans community as a reactory, event that they experience or undergo like violence, right? And so as a result of that, when do I have the conversation? When does one feel safe enough, right? Likely after they vetted the person, and they might have gone through some, maybe exploratory questions to get a better sense of how this person might react to the event, right? It might be to indicate, day one, that I am trans and that is who I am and that's my identity, and I want you to know right now. And that person will feel comfortable doing that day one, or maybe even through, some sort of app, right? Because that's how people date now. It might be kind of later in the dating experiences before sexual experiences happen, where they feel like confident and safe enough to share that with somebody.
Right.
Or it could be very much that they are testing the waters and maybe kind of drop, not to say some hints, but maybe folks will be like, what's your experience with trans community? What's your stance on trans women and sexual orientations? What do you know? What are your questions or anything like that? Just to kind of test the waters. Sadly enough, for like women, regardless, like there is a lot of that vetting that has to happen in all of our dating experiences, because not every man is a safe person. And not every man has good intentions, right? So we all women have had to develop these kind of skills or these kind of interviewing techniques to determine if this person can be safe for whatever reason, right? And it's just that trans women, also people who are non-binary, just have to do this a lot more because they are often targeted simply because of this identity.
Okay, all right. Well, we have opposing views, and that's fine. That's totally fine.
That is fine.
It's just a conversation. That's all it is. So
yes.
All right. Well, last two questions.
Okay.
First, what are some good foods for sexual libido?
So I saw this question and I was just like, it is such a kind of like wives' tale, right? Of things that like are arousing. There is research to also include things that make you taste better, right? Or things that definitely don't make you taste good. And so the research around there will talk about like dairies and like red meats and things like that will impact somebody's flavor or impact how they taste. But things
foods like pineapples,
like those naturally sweeter foods are supposed to be, supposed to enhance your flavoring. So like pineapples, kiwis, right? Nothing that has like basically no animal product. But there's like the research is not conclusive on this, right? And also how quickly these things go through your system. It's not because I ate pineapples today that I'm going, that this lasts for 7 days or something, right? Similarly to like us eating foods and we're passing foods, us drinking water and we're urinating and things like that. So there is this kind of like, again, this like old wives' tale, if you will, or these kind of like cultural myths of what can make people taste better, what can be erotic. So you have like ginseng is supposed to be an aphrodisiac, right? Oysters are supposed to be an aphrodisiac. There are certain
chocolate,
like,
right?
What's that?
Chocolate, right?
Chocolate is supposed to be an aphrodisiac, but also because chocolate helps to release those like feel good, brain chemicals, right?
Right.
And so that is supposed to help. We also have this idea that like certain substances, is an aphrodisiac, which is not the case. Maybe certain.
You've heard of maca powder?
What's that one?
It's some powder that I've read about. It's called Superfoods from David Wolf, where he said something about taking it. It would like improve sexual vitality or whatever. So, but yeah, I was just wondering about that.
Maca powder.
Yeah, MACHA.
Okay. Yeah, I'm definitely going to Google this. But yeah, the research is really like inconclusive of like if these things work, how do they work, what is the dosage of these things working, right? How long do you have to be in the presence of a certain smell or something for it to work? Yeah, what research does tell you works for increasing sexual arousal is like connection, right? A lot of people kind of need a sense of intimacy. to assist in improving those sexual experiences. Not everybody, but lots of people can have sexual experiences without like an emotional connection, and that's fine. And those sexual experiences can be awesome and super great, right? But it's that those adding those different layers of where you feel, like I was saying before, where you feel safe in the relationship, where you're feeling like vulnerable, you can be vulnerable with this person in the relationship, tends to enhance those sexual activities for longer periods of time.
Okay. All right, finally, how would you appraise today's sex education in schools? Now, the reason why I ask is because, like I said, I have an elementary sex education from back when I was going to school, because all I was taught was, like the number one thing that I retained was to use condoms, so that way you won't have STDs or have any unplanned babies. Fine, I did that. Fast forward up to age 35 when I had my first kid, in a process of baby making, it got very tedious, and it really wasn't fun, because I mean, because I always thought that as long as you wasn't on your cycle, I could just go ahead and come, and then voila, we'll have a baby. So I did not realize that the ovulation period was like maybe 2, 3, 4 day period, and then once we missed that, then we gotta wait another
Gotta
month.
try again next month.
Like, I did not know that until I was 35 years old. So yeah.
Yes, right. And that's what we were talking about earlier, like the things that we would do differently, or the ways that we would approach sexuality as adults would look very, very different if anybody told us this stuff when we were younger, right? So I think that we need to do a better job within our sex ed. And then the follow-up question is often like, is this the school's responsibility to do this, or is this parents' responsibility to do this, right? And that's likely the question that came up when sex ed was even brought into the curricula of schools, right? Like, why is this something that we have to teach in school? Why isn't this something that parents are teaching? I think the information should come from all the people in this child's life, from all the people that they look up to, from their medical providers, from the people who are caring for them, their parents, their guardians, whoever is helping to raise these people, from the school administration. I think that, or my perspective is that if we normalize this, right, if they're hearing it from multiple people, if we are normalizing this experience, we remove that layer of taboo-ness, right? We remove that layer of fear-based experiences. Like my mom was one of those people, and she wasn't raised in this country, so that could also be a layer, but she was one of those people that really didn't have a sex ed. And so her first kiss in high school, she had immediate fear that she was pregnant.
Oh, wow.
Right. And so and we're coming from that to like, the sex ed that you and I got of like, don't do this without a condom. If you're going to do this, then definitely wear a condom, but like, maybe don't even do this, because if you do this, you're going to have a kid. Right. And these kids now are way more progressive than my experience as a teenager and a middle schooler, right? They are exposed to different gender identities. They're exposed to non-binary, gender fluid, trans individuals. Cisgender is now part of the language that they know, what I did not know that when I was coming up, right?
A study that came out recently in which, like, I want to say it was Gen Z, they're like having less sex than previous generations. Something like that.
I believe that. I very much so. From like my nieces who is a high schooler, and she was just like, I'm just really focused on my education. I'm like, girl, you were 14. Like, what? You don't want to kiss somebody? She's like, I'm just really focused on my education.
Oh God.
Yeah.
For my 2 little girls. Wow.
Yes. I think there's a lot of, I think that these kids, because they're educated from a number of different people, right? Like they're educated from their parents or guardians. They're also educated from school, but they also have access to information way quicker than you and I had. Dial-up was part of my internet growing up experience.
Yes.
Right. And which is not quick at all, which you get in trouble for because you're blocking up the phone. So they just have so much exposure to stuff. So I do think that our sex ed curriculum needs to catch up to what their life is now, because they're exposed to different genders than we had words for. And additionally, kids who, or humans, kids, people who are in same-sex relationships, if we think that us as heterosexual people had very little education about pleasure, right? About what it means to self-pleasure, or how to experience or receive pleasure, right? From your opposite sex partner.
Mhm.
Imagine what's happening for the folks who are in same-sex relationships. They got nothing. They literally had nothing. They had no experience, no discussion, no even, terrible sex ed about what it means to be in a same-sex relationship, and sexual practices or behaviors that go into that. And so again, this brings me back to like my soapbox of how important a discussion of pleasure and desire is in sex ed. Additionally, if we just normalize these things, and this is always the concern of like, if we talk about it, then kids are going to do it, and then they're going to get pregnant. But the reality is that kids will do it regardless, right? Like, kids will have sex. It's not because they're not exposed to it or had no education or they had good education. Kids will have sex, but we can empower our children to have safe sex. We can empower our children to be able to advocate for themselves of what they expect from their sexual partners, right? How many incidences or experiences can you even name of like abusive relationships of teenagers, right? Because we're taught that men should be the aggressors. Men should have the power. And like I said, women are the gatekeepers. And so that can easily translate into these high school relationships where the male in the dynamic is abusive, very much abusive, either that physically or verbally, because that is what they witness at home, or that's what they're picking up from the world as what a man should be and how a sexual man should be, right? And then we have girls who are just like, well, he loves me and he cares for me. He might do these other things, or he might say these not nice things, but like, he loves me and he cares for me, and I'm his girlfriend. And how great is that for me to be his girlfriend? And you're like, but no, if we have the conversation of what you are owed as a human, and that your pleasure also plays a role in this relationship, I just think that we could do a lot more preventative work if our kids were aware.
Now, T.I. caught like a lot of heat when he openly
yes
said that he took his daughter to the doctor and just to make sure that her hymen was still intact. As a father, I understand. I get it. I got 2 little girls. I totally understand what T.I. is coming from.
No, what a whole violation. What a whole violation.
T.I. wasn't doing the exam himself.
Thank God.
He was taking his daughter to the doctor, and then whatever the findings were, he would get the information from the doctor.
His daughter is grown. She's not 5 or 10.
Oh, she was like 16.
Yeah, she has autonomy over her body.
But she's not grown yet, though.
She's not legally grown, right?
Right.
But she does.
I'm talking as a father with two girls, so that's my position.
She has autonomy over her body and what is shared and what is medically necessary to be shared. Like, that's not a tumor in her brain or anything, right? That her parents need to have a knowledge of. I'd also question that providers, because I know in a lot of, I don't think this is a federal law, so this might be dependent state by state, but like, folks as young as 14 can decide how much of their healthcare is known by their parents, even though they're not, legal adults yet, right? So yeah, I don't know what it is.
Georgia. So being at Georgia, well, it used to be a red state. I'm pretty sure that they're pretty much conservative on those issues. So I'm pretty sure that they had, Tia had like the green light to like know everything about his daughter.
Oof. Yeah, that just a little bit grosses me out. I mean, and so this is where that kind of like misogyny or sex, like really misogyny and sexism comes in, right? Because he's not asking the same questions with his like male kids, right?
It's double standard. I mean, we understand double standards. I mean, some benefit us, some benefit y'all. So at the end of the day, is all a wash.
And also right? this sense of like a girl's sexuality belongs to her father. That's the part that feels really creepy about it for me. That's the part that doesn't feel good at all. That like, I do not have ownership of my own body. And that my body and my sexuality can be regulated by you. That this is also just throwing back to like dowries, right? Like a man giving away her daughter and like being paid for that giving away of her daughter, or his daughter. I'm sorry, his daughter. But also if we, it's understandable that parents want to know if their children are safe. It's 100% understandable about that.
That's all he's doing.
Well, why not have a conversation with her? Why not take confidence in the values, right? And the
Kids lie. Kids lie.
Why would your kid lie? Why do kids lie?
Because if they really want to do something that they don't want their parents to know about, of course they'll lie about it.
So
I mean,
basically it's to avoid punishment, right?
Right.
Kids lie, people lie, not just kids, right? We could expand this. People lie to avoid some sort of negative consequence or adversive reaction, right? What and this, you know, it's coming with a grain of salt. I am not raising any like teenage children at all. But as somebody who was a teenage person, my parents would have gotten significantly more from me if I felt safe enough to tell them the truth. Again, I'm coming from parents who came from a different country, who my mom thought that kissing got her pregnant. So I understand what they're working with. And I understand what that looks like for them, right? And I do not fault them in any way, shape, or form. I think they did a good job, but I'm biased on how I turned out. But I again, if we are, as parents, if we're expecting, parents create adults, right? We create adults, and parenting is instilling values into our kids. And one of those values, I think, is a sense of self, right? A sense of confidence in who you are, a sense of stability in who you are, right? And so if I can nurture relationships with my children about things that will make me as a parent uncomfortable, because I think parents don't talk about sex because it makes them uncomfortable, not because it makes their children uncomfortable, then my kid would have no reason to lie to me about that. Granted, we hope, right? I think a lot of parents hope that their children will wait to have sex until at least college, at least they're out of their house or something, right? That's the hope. The reality is that might not be the case. And I think parents know that too, right? We look at our own personal experiences. We look at like when we were growing up and what we're seeing now. The reality is it's likely not going to happen, that they're going to wait till they're 18. Would you want your kid to come to you if they had concerns about this, or would you want them to lie because they're afraid of your reaction?
I want to have an open door policy where they can come to me with anything, of course their mother as well. Yeah, I mean, it's hard. I mean, you know, I just don't want to think about it, but I totally agree with T.I.'s standpoint. And plus he's a celebrity, so all types of guys is going to try to get at his daughter. And plus his daughter is very attractive. So yes, I totally get why he did it. It's just that, you know, him having this patriarchal mindset, it kind of like doesn't align with the whole, you know, modern way of the overall mainstream media gynocracy. So
and also to it's not cool that he did that, but also to like tell the world that you did that, right? To tell the world about your female daughter, your daughter's most intimate parts of themselves. That was also not really cool as a parent to do.
Yeah, that should have stayed in house. It should have stayed in house.
Yeah,
I totally get that. Yeah,
right. Like, talk about like potentially damaging. Now, anything I share with you, apparently you're just going to share on the world the next time you got on a news system, right? So now I'm less likely to share with you as my parent because I can't trust you with stuff, right?
Okay. Yeah. Okay. Well, Dr. Jacques, I really appreciate you taking the time out on a Friday night. I mean, you could have been doing anything, but you chose to come on a podcast and have
with
a
you right now.
I really appreciate it.
Absolutely.
And, now, like, do you have like sessions that you like do on a regular?
Sessions with like therapy sessions, or
Yeah, like can people like do like Zoom sessions with you?
I see what you're saying, like in terms of like private practice.
Yeah.
So So private practice goes into like, what's the word? Licensure, right? And like every state has a different body. So like I'm definitely able to treat folks in Pennsylvania based on my license. And because I work for the federal government, which is really nice. If anybody goes into work with the federal government, it's nice that you can, your licensure travels with you. So even if I were to find a job in LA, I don't have to be licensed in California. I can be, keep my own license. So LinkedIn is a fantastic way to find me, but I don't have any, social media public accounts. I'm unfortunately just not that cool to have that kind of presence. But LinkedIn is, I guess, the Facebook that people can contact me on.
So if someone from like North Dakota was to see this podcast and like, oh, she seems pretty cool, let me see if I can get in contact with her so I can like have a like a Zoom session with her. Like, is that like allowed as far as your standpoint?
So in terms of licensure, no, they'd have to be in Pennsylvania resident. Yeah, but thankfully, because sexuality, sexology, sex research, sex therapy is like such a small world, I likely know somebody that they can work with and can refer them to somebody in their city or in their state that is a qualified provider.
Okay, cool. All right, well, yeah, you definitely a friend of the show. I definitely want to have you again.
Okay.
We can have some more topics to talk about, and yeah, I'll give you a future date, and we can try to work something out. But yeah, I really appreciate it. Thanks for taking the time out. And ladies and gentlemen, this is Dr. Natacha Jacques, and this is Cornerstone Podcast signing out. Talk to y'all later.
Bye.
All right, see ya. Thank you. Bye bye.
Of course.